Okay, so first, hi everyone. So first thing, where you will use this CPT book? My question, where you will use this CPT book in medical coding?
OP
Outpatient procedures.
radiology outpatient.
Outpatient procedures. OP, outpatient. Outpatient procedures. For outpatient procedures, you will use this CPT 2024 book for procedure coding. Okay, for outpatient department, if they done procedure, you need to use this CPT book. Okay, so what is the meaning of outpatient?
Patient leaves hospital
Patient will discharge within 24 hours from hospital.
Discharged within 24 hours in the hospital, called as outpatients. Who stays in the hospital more than 24 hours, we call as inpatients. Okay, if the procedure performed in outpatient setting, you can go with CPT coding. Okay, this is the CPT book. Okay, first, if you turn the page CPT, you will get these symbols modifiers. Okay, before going to that, we can discuss how to use a CPT book. Okay, how structure of CPT. What is the CPT code structure? CPT was 5-digit code, numerical code. Okay. CPT book is 5-digit numerical code you will get. You will use in this OP. Okay. Outpatient specialties you can use. So first thing, what we need to learn in the CPT book? First, symbols. Modifiers. CPT code leading. Okay, these three things we need to cover in the CPT. Clear? So first we can go with how to use the book. So while if you wanna read the book, first thing you need to remember the symbols. Okay, first you need to learn about the CPT symbols before entering the book. See guys, you will get, if you turn the main sheet, you will get the symbols. The symbol available before the code. Okay, how we will get the symbol means in the book, you will get like this plus yash. Okay, you will get like these symbols before the code. So what is the meaning of these symbols? We can discuss. See, at least you need to remember 3 symbols. Okay, plus symbol exempts to modifier 51 out of numerical sequence. This revised code, new code, if you learn, remember or not, no use. At least you need to remember these 3 symbols meaning. Plus symbol means
Add-on.
add-on code.
Hello.
Add-on code. So please put in mute.
No audio. Hello.
Hello. Tell me, bro. So plus symbol means add-on code. Add-on means
Add also means two codes or something.
add-on means you need to give always secondary. Okay. Always you need to give this add-on symbol code secondary. Additional codes. Okay. This plus symbol codes was additional code. You never code as primary. First thing remember. Add-on codes you never code as primary and you never code as alone. Okay, these are all add-on codes depend on primary code. always. You need to code primary code, then add-on code. If when you are coding plus symbol code, remember you need to code two codes, two CPT codes, minimum. Okay. Any doubt? Plus symbol add-on codes. Check 13006. What is the definition? Each additional lesion in addition to code for primary procedure. Use 13006 conjunction with 13005, which means always 13006 you need to use with only 13005. You never code with alone 13006. Clear? Any doubt how to use the add-on code?
No, sure.
Thank you. So next, hash symbol. Okay. Hash symbol out of sequence. Actually, now all the CPT codes you will get in the sequence wise in the CPT book. Okay. So, but check here. The code was started with 13004, 13005, 6, 7, 8, 9, 10. They mentioned code is out of numerical sequence C 10021, 10035, which means this code will available in this range. Okay. If you seen any code, they said code is out of numerical sequence C on the code range means you need to search on that range for the code. So for 10004, where you need to search 10021 to 10035. So come here 10021 started. Then they given 10004 means these all are out of numerical sequence. That's why they given a symbol for all codes. Check 1 2 1 4 work 1 2 1 2. Okay, all are out of sequence. Again started 130. They won't given symbol 35 36. These all are sequence wise. 40 60
Out
60.
of numerical sequence means?
The code you will get out of the order. Actually, the CPT codes will be arranged based on the order wise, like 1 2 3 4. How you are
Okay, this
written, na?
is like 6 and below that 7 is there.
Yes, exactly.
Okay.
Okay, 6 7. Na? This is the sequence, right? If any
Yes.
code miss the sequence means you will get like this play hash symbol, and where you will find the code they will give like this. Okay, in red color. Okay, in that range you will get, suppose. Okay.
Okay.
Clear? Hash symbol plus symbol, any doubt?
Plus symbol is
No.
add-on, and it should not be like after primary
Plus symbol
code only.
was add-on code, you never code as
Yes,
allowed.
yes. The as symbol is out of sequence, right? Out of sequence is what is
I didn't get you.
out of sequence is people will just like order wise, right?
Yeah, CPT codes they arranged by order wise, all are numerical codes. Na number sequence wise they will arrange. If any code missing the sequence, you will get hash symbol.
Okay, sir. I didn't get this out of sequence.
Hmm?
I didn't
Please
get this
put
out.
it mute actually, everyone. Then who are asking question, you will get easily. Okay. Then yeah, now you can ask generally. Clear? Out of sequence means the code you won't get the sequence. Sequence 2, 3, 4, how you return. Suppose one after 4, you will get 7 means what is the 5, 6 sequence missing, right? That 5, 6 numbers you will get somewhere. Clear? Are you getting my
Actually,
voice or not?
your voice is breaking before.
Completely.
Yes.
Now?
Yes, now audible.
Can you repeat it, sir?
So how we will return numbers generally 1 to 10 means you will write 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, right?
Yes.
Suppose if I said 1, 3, 4, 5 means 2 missing, correct?
Yes.
Yes,
That
sir.
2 you missed, but the 2 present below 8. Okay, 8 to 9, 10 they given instead of 1, 2, 3 they given 8 to 9, 10. So that 2 was missing the sequence, right?
Yes, sir.
So for that sequencing missing means they will give this symbol.
Okay, sir.
Okay, clear?
Yes, sir.
So next modifier 51 exemption. So this symbol if you find beside of the CPT code, you never use 51 modifier for that CPT codes. Okay, you never use 51 modifier for that CPT codes. Okay, exemption to modifier 51. Where you will find this exemption to modifier 51? CPT codes. Okay, they will give one of the list. Exemption to modifier 51 CPT code list they will provide. Come to appendix E, C. Summary CPT codes exempt from modifier 51. You will get here the CPT codes. Okay, for these CPT codes, you never use 51. Clear? Beside, in the between notes also, if you find that symbol, you never use 51 modifier for that CPT code. Okay. Clear?
It just like exclude note.
Yes,
Exclude one
exactly.
and exclude
Yeah,
two.
like exclude one in shortcut.
Okay.
If you see that symbol, don't use modifier. That's it, okay?
That particular modifier we don't use, or
Only particular modifier, not all.
okay.
Only 51 modifier. B. See appendix E, these are the codes only. Okay, for this course. Okay, suppose I will go to 20697. See, they given that symbol, right?
Yes.
Like that, okay? Clear? How you will get the symbol? So these three symbols, you can remember at least. Any doubt in these three symbols? Thank you, guys. So after learning the symbols, so symbols clear, right?
Yes, sir. This is symbol.
Then modifier CPT code leading pending. So before going to the modifiers, you will remember, or sorry, after completing the modifier, I will explain how to use CPT book. Then easy. So then we can go through modifiers. Okay. Symbols clear, modifiers clear. Next. So modifiers also will get below only. So remember, in exam, you will get 3 MCQ questions from modifiers. Okay. In this page only, we will get 3 questions. Okay. In this page, you will get 3 questions. 3 MCQ questions you will get from the modifiers. Okay. We can discuss that 3 questions and related to modifier, when you will use, what is the modifier, everything. So modifier means Modifier means? Anyone?
Hmm.
What is the meaning of modifier?
Modify the payment.
Mhm.
I think
Give additional information.
rating we have.
Mhm. So no one is working in CPT.
Modifier gives additional information.
Modifier will give some additional information. Yeah, no problem. You can see the screen. Okay. Modifier is 2 characters, letter or number. Okay, it will be 2 digit only. Append to CPT or SCPCS level 2 codes. Okay, you can use these modifiers with CPT coding. So SCPCS you don't get in CCS, so leave it about SCPCS. You can use with CPT codes these modifiers. So the modifier provides additional information about the medical procedure, service or supply involved without changing the meaning of the code, which means the original definition of the CPT code will not change. But if you add the CPT modifier means you will give some additional information related to the procedure, but without changing the original definition of the procedure. Clear?
Yes.
Yes.
So thank you. Now we can discuss about modifiers. So first we can discuss level 2 HIPIX modifiers. Okay, level 2 SCPCS modifiers. These are alphanumeric or letter number or only letter you will get in this series. Okay. So first remember E1 to E4. E1 to E4. What's that modifier? Eyelid modifiers. Eyelid. Upper left eyelid, lower left eyelid, upper right eyelid, lower right eyelid. E4. So E1 to E4. If any procedure they performed on eyelid, based on the eyelid, you need to add this modifier for the procedure. Okay, in generally, while we are working in PCS like inpatient, you will get more specific body part, right? Like right, upper, left, lower, each and everything you will get more specific, na?
Yes.
But in CPT, in outpatient, we don't get that much specific body part for the procedure. That why you will use these modifiers to identify the part. Suppose they done blepharoplasty on right upper eyelid. How you will code? So blepharoplasty code was, suppose I am telling, I am not sure. This is the blepharoplasty code, suppose. So they done right upper eyelid. What is the modifier you will add?
E3.
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 You need to code like this. Okay. Suppose if they didn't mention any modifier, if you coded only CPT code means, what is that meaning? They can't identify, right, for which eyelid they done the procedure.
Laterality.
No, I'm saying if you are not added the T3 means it was possible to identify the eyelid location.
No.
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 No, right? So that's why you need to give these modifiers you need to use. So next modifiers FA to F9. What is the modifiers?
Finger modifiers.
Finger modifiers, okay. Okay, finger modifiers. So tell me F3 means
Left hand.
Left hand fourth digit.
Left hand fourth digit.
Digit.
left hand fourth digit. So remember guys, if they done any procedure on the fingers, you need to give this F series modifier. So here they mentioned digit name third, fourth, but sometimes you will get the digit name. You won't get the number, you will get the name. So tell me what is the second digit name?
Trigger finger.
Index finger.
Index.
Third finger?
Middle finger.
Middle finger. Fourth finger?
Ring finger.
Ring finger.
Ring finger. Fifth digit? Little finger. Sometimes they will give, how they will give, no? Laceration happen on left middle index finger. Sorry, left index finger. Okay? Laceration on right ring finger. Laceration on right little finger. They will give like that. Okay? Sometimes they will give number. Sometimes they will give name of the finger. Okay?
Okay.
Okay.
Clear?
Clear.
Sometimes they will give third digit, second digit like that. Sometimes they will give name of the digit like for ring finger, index finger, little finger. Okay, you need to remember. Then F8 to F9 clear, right?
Yes.
Any
Shiva,
doubt?
yes,
Uh,
here thumb and directly second digit they are coming like
I didn't get what you were saying.
second means if they mention index finger, then we have left hand index finger. Then here F1 we have to choose.
Yes, correct.
Okay.
That only, no? So sometime they will give second digit. Sometime they will give that name.
Okay.
So any doubt on F series?
So,
So come to T series, okay? TA to T9, same guys. If they're done for fingers, F8 to F9. TA to T9, toes, okay? Toe for foods. Toes, if they're done procedure, you need to give TA to T9. Check once. So here, left foot, great toe. Left foot, second digit, third digit, fourth digit, fifth digit. Or they will give lesser toe. Okay? Lesser toe, like left foot, second lesser toe, third lesser toe. They will tell like that. Great toe, lesser toes. Okay, for each toe we don't have specific name. They will tell great toe and lesser toes. Okay. Any doubt?
No, sir.
Thank you, guys. Next. So after that, you need to learn LTRT. Okay. LT means when you will use LT.
Left side.
Right.
RT,
Right side.
right side. So when you will use RT, when you will use LT.
left side for LT, right side for RT.
So what left, what right?
If a procedure
Other
done
than
in right
Procedure
side,
with where proper.
modifier. Two hand.
So when you left side of the body, suppose for some body parts we have two, right? If you are identify like right and left, then if they done right side, you need to do RT. If they done left side, you can give LT, like hands, legs, kidneys, lungs, eyes, ears. Okay, if they done right ear, RT, left ear, LT, right eye, RT, left ear, left eye, LT, right hand, RT, left hand, LT, right shoulder, left shoulder, right knee, left knee. Clear?
Yes.
So if when you are using right the body part RT, left LT, so then if they done both sides same procedure, okay, suppose I'm saying if they done foreign body removal on the both eyes, splint performed on the both hands, so at that time you will use CPT code 2 times RTLT, or
We can
50
give 50
modifier.
modifier.
50
One more
modifier.
modifier, 50 was bilateral, okay? If they done same procedure bilateral, you
Yes.
can use this 50.
Mm.
So how you will code? So physician performed foreign body removal on the both eyes. You will give 50 modifier, or you will code 2 times and you will give RTLT.
Modifier. 50 modifier.
50 modifier.
50 modifier, okay? If the same procedure performed on both sides, you need to give 50 modifier. If they're done right side RT, if they're done left side LT.
Yes, sir.
Clear?
Yes, sir.
Yes. Yes.
So any doubt RTLT?
No.
So next modifiers we can go. Okay. So remain no issues right up to now.
Yes, no.
No. No.
So next, one more modifiers we can discuss, guys. So please remember, up to now what we discussed, you will get one question. That was, they will ask, what is the modifier you will assign if they done procedure on right foot toe, third toe, right foot, third toe,
T3.
T8.
T8, left foot, third toe,
T2.
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 So right hand, third digit,
F8.
F7.
F7.
Left hand, third digit,
F2.
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 okay, clear, right? If they given any finger or any toe, you can able to assign the modifier, right?
Yes.
Thank you. So one question you will get, either finger or toe they will ask. Okay. So next, after that, one more question you will get in this X series modifiers. Okay. X series modifiers. So please take the snippet. You don't get in this CPT book these modifiers. Actually, we'll get in the HIPIX books these definitions, but we won't carry HIPIX book for the exam. Okay. They won't allow. Only 3 books they will allow. ICD, CPT, PCS. So HIPIX they won't allow. You can remember these 4 modifiers definitions. Okay, these are HIPIX modifiers. You don't get in the CPT book, guys. Please remember. So when you will use the X series modifiers means CMS allow the modifier 59 instead of 59. Okay, the 59 modifier they divided as 4 subunits XE, XS, XP, XU. Same meaning. Clear? So instead of 59, we can use this X series modifiers. Okay. So if you use 59 or this X series modifier, same meaning. Okay. XE, XS, XP, XU, please remember. So what is the meaning of XE?
Separate encounter.
Separate encounter. So to describe separate encounters on the same DAS. DAS means date of service.
Date of service.
Date of service. So on the same date of service, if they done separate encounter, which means two encounters on the same date, morning and evening, like two different encounters, not only morning, evening, in the day, two separate encounters. If they're done, you need to use
XC.
XE. Okay, the procedure performed on separate encounters. Okay, they done half of the procedure. Then again they done separate encounter for the remaining procedure. The service that is distinct because it occurred during a separate encounter. Okay, different encounter that was happened. Then XE. XS separate structure. Okay, separate. Hello. Separate structure. Okay, service that is distinct because it was performed on separate organ or separate structure. So when you will use this XS means, please go through here. Okay, different organs, different anatomic regions. Okay, in limited situations on different non-continuous lesions in different anatomic regions of the same organ. Okay, sometimes. Then different organs, different anatomic regions. Okay, if they're done procedure on sigmoid colon, descending colon. Okay, separate structures. You need to give XS, XP, separate practitioner, which means different practitioner. Okay, the service provided by that separate provider, separate practitioner. Then XU. So XU, remember, usual, unusual, non-overlapping services, which means because the two procedures are completely different. Okay, both are not overlapping each other. Okay, both are unrelated procedures. If they performed XU, like one injection, IV administration, one splint application, one laceration. Okay, unusual, non-overlapping service XU. Generally, you will get while coding XU mostly, I think, right? You will use XU modifier. Correct, no? All are working in CPT might be
Yes,
then.
yes, sir.
Okay,
Sir,
XU.
can you explain XC once? For which should I use that for ENM code or CPT code, procedure code?
Codes, remember, these all modifiers you need to with only procedure. Don't use any NM for this. 59 you never use for NM, na?
No, sir. No, sir.
Don't use modifier 51 XN, other NCC PTI. Okay, do not, modifier 59 should not be append to ENM service. So these modifiers also you should never use ENM. Only modifier 25 you can use with ENM. Okay. Clear? Only CPT procedure codes. Okay.
Okay, sir. For procedure code, we should append this.
For procedures only. Okay. While we are using this X series modifiers, must be they done two procedures. Remember, two procedures they will be done. Okay. Two procedures they perform while we are adding X series modifiers. Clear?
Hello, sir.
Bolo na.
If same procedure done on two encounters, then can we
Same procedure.
append XU with the second encounter?
Same procedure.
Yes.
So if they done
Like
same
for example,
procedure,
glucose test done
Huh?
twice.
tell me for example.
87804.
87804, 87804, same procedure they done.
Yes.
No problem. I will explain that under.
Uh,
Okay. No
Okay,
issue. So remember up to now so what you said I will explain. Okay now. So these definitions you understood, right?
Yes.
yes, sir. Yes, sir.
Thank you. So now you asking they done same day, repeat the procedure, correct? Same procedure they repeated.
Yes, sir.
87804. Correct. Suppose they done
But on
87804.
separate encounter.
Same or different encounter?
Separate encounter.
Same day or not?
Same day.
Same day they done repeated. That's it, right?
Yes, yes.
So if any pathology test repeated on same day, you need to use 91. Okay. Repeat clinical diagnostic
Okay.
laboratory test. Okay. Suppose
Okay.
if they done on different encounter same lab, then no modifier required. Because na, why you will code 87804 on different encounters you will add one time only, right?
Yes.
Then nothing. So 2 encounters you never club, right here.
Mhm.
Okay. While you are using this clinical diagnostic like lab tests, remember if they repeat same test same day, for second code you will give 91. Okay.
21.
Not X series, 91 unit.
Sir, if it is within 1 to 6 series, then
Then why they will perform same test same day 2 times?
suppose the first encounter, the procedure the provider done is complication occurs from that site.
Okay.
Bleeding occurs or something like that.
Mhm.
So again, patient come on the same day to repair it again.
Okay. At that time you need to add modifier. That's it, no? Again, for second procedure, you need to add modifier. If they're done procedure, you need to code CPT and you need to add modifier. Okay.
Okay.
Modifier for
modifier
both
we
CPT
can
or
discuss.
second CPT.
Second CPT always you need to give modifier. Okay. While your patient coming to the complication, second CPT will give modifier. Remember, guys, while what up to what level I explain, if you ask doubts, it will be easy. You are asking beyond. So first, if you understood all the modifiers, then your doubts maximum will clear. You are not going to enter to explain the remaining modifiers. That's the problem.
Once explain overlap.
So up to now, any doubts?
Yes,
No,
sir.
right?
Overlapping services. Can you explain once, sir?
So overlapping means both are unrelated. Okay. Both are unrelated. Not overlap means both procedures are unrelated. No relation between the two procedures. Okay. They performed IV medication. Then they done laceration. They done laceration and they applied spleen. They done intubation. They done another procedure, placement of central venous catheter. Both unrelated XCU. Okay.
Okay.
So guys, remember, next I will explain now. 91 when you will use, if they repeat the clinical diagnostic laboratory test means only pathology lab test. This pathology lab test start with 8 series, okay? The lab test start with 8 series. If they performed same lab test 2 times on that day, you need to give 91 like CBC, morning, evening. They taken 2 times blood blood test, CMP, okay, COVID test, any lab test, if they perform 2 times for second CPT, you can give 91. Clear? $91, any doubt?
No, sir.
So remember, you don't get these modifiers and all, don't put more effort on the modifier. Whatever the modifier you will get in exam, I will tell. So X series modifier, you will get 1 question. F series, T series, 1 question. Okay. That you can clear means you will get 4 questions. Apart from all modifiers, you will get only 1 question. That was 52. Okay. Reduced service. So remaining modifiers all are your education purpose. That's it. Okay. For exam, you will get only 3. So 91 clear, right?
Yes, sir.
So next come to 76, 77. What is that meaning? Repeat procedure or service by same physician or other qualified healthcare professional. Repeat procedure by another physician or other qualified healthcare professional. So if they done lab test means 91. If they done procedure means 76, 77 based on the physician. Same physician, if they repeated the procedure, 76, like EKG, they done 2 times. 76, same procedure. Okay, same physician. Okay. If they done different procedure, EKG,
77.
okay, 77. Okay. Any procedure, before you asking now, they done repeated means based on the physician, you need to add second time 76, 77. Clear?
Yes.
91, 76, 77 difference similar. Okay. For lab test 91. For procedures based on the physician 76, 77. Clear? Huh?
Yeah,
So next 78, 79. So both are last one, post-operative period. Okay. Post-operative period. So post-operative period means
After surgery.
after surgery. Good. Okay. Suppose for patient, they done one major procedure, okay, like appendectomy, they perform. So after the procedure, after 5 to 10 days, that appendectomy site was swelling. For patient came to the hospital for the swelling. They done some workup or some treatment for that site. Then they leave the hospital. So that for that patient will get benefit or not?
Yes.
Yes.
Suppose you are the patient, you went to the hospital, you done major surgery, they done suturing. After 10 to 15 days, you went to the you will again go to that hospital for suture removal. You will pay again for the suture removal.
No.
Now only you said yes. No, right? We don't do any payment again, right? For that related surgery if you go to the hospital. Yes or no? Clear? You will pay or not for related procedure, again you go to the hospital. They done some workup on the procedure. Yes. You will pay for that or not?
No.
No, guys. So this is all included as a surgical package, global period. Okay, you can remember
Yes.
this word here. Surgical package. Okay, once any patient, if you go to the procedure, okay, if you plan for procedure, you will spoke like package for that procedure. Okay, you will spoke like 40,000, 50,000 package. In this package, including pre-operative visits, okay, follow up before the procedure, you will follow. No? They won't do procedure directly on the same day, right? They will schedule you. Come on after 3 days, Don't drink any water, don't eat anything. Empty stomach, you can come to the hospital. They will give some guidance, right? On the surgery day, how you need to come. Yes or no?
Yes. Yes. Yes.
Yes,
Okay.
yes.
This pre-operative visits, surgery day. After the surgery, post-operative period. Okay. Some major procedures you will get 90 days. Minor procedures 10 days.
Yes, 10 days.
10 days. Okay. This all included in the global package, surgical package. Okay. If anything happen in this package, in this period, like surgical package period, that all included in the surgery package. Okay. They won't get any benefit again. Clear? Huh? But the procedure was made, the done workup was major on the surgery side. It was complicated. They done some over workup on that side. If swelling, pain, suture removal want to get, but they done some additional workup, some major things on the procedure side. Then they need to get payment. No? For that time, you need to add this 78, 17. Remember, unplanned, return to the operating procedure room by same physician or other qualified healthcare professional following initial procedure for a related procedure. Okay. Following a initial procedure related if you patient came to the operative room in the post-operative period, you need to add 78. If other than unplanned, unrelated procedure, okay, unplanned same procedure 78. Unrelated procedure. So patient was on surgical package for appendectomy, but on that period, patient have fracture. So they done fracture work procedures. That was completely unrelated to the surgical package, right? Fracture reduction.
Yes, sir.
Yes.
So
Yes.
they need to get payment, na? That's time. Unrelated procedure, if they performed on post-operative period, you need to add 79. Okay. If they done some unrelated procedures, patient was in post-operative period, but they done procedure other than post-operative related procedure, like that procedure was not included in the surgical package, then you need to add 79. Okay. Then 73, 74. See, discontinued outpatient procedure prior to anesthesia administration, discontinued outpatient procedure after anesthesia administration. Here anesthesia means, remember, general anesthesia. So for major procedures, they will give general anesthesia, right? What is the meaning of general anesthesia? What is the use of anesthesia?
To sedate someone.
Hmm?
To
What
sedate.
will happen?
Sedate.
Sedate. So, what is the meaning of general anesthesia, not sedated? Okay, completely loss of consciousness, total body loss of consciousness. Okay, local anesthesia means certain body only, sedation. General anesthesia means total body unconsciousness. Okay, so before going to the anesthesia administration, discontinued outpatient procedure. Suppose if they want to do one major procedure or minor procedure, before starting the procedure, they will do some operative room setup, right? They will prefer the patient. Okay, they will talk the patient, they will set the operating room, everything they will do now. They will ready to the
Yes, sir.
patient for the procedure. They will do some workup before the starting the procedure. So, but at the time of anesthesia, before going to administration of anesthesia, suddenly hypotension happened, tachycardia happened, fits came. At that time, the anesthesiologist informed to surgeon, surgeon will cancel the procedure. But they done all the workup, right? For that, at least they get some benefit, no? That's why you need to add 73. But after anesthesia administration, suddenly patient was not good due to the anesthesia. Suddenly happened hypothermia, hypotension, hypertension, tachycardia, bradycardia. Okay. Then surgeon decided to stop the procedure due to patient condition. After administration of anesthesia, due to the patient condition, surgeon stopped the procedure. Then what modifier you will need to add?
74.
74.
74. Okay. Before administration of anesthesia, 73. After administration of anesthesia,
74.
74.
okay. Thank you. Then, so come to 25 and 27. Okay, 25 and 27, guys. These two are ENM related modifiers. Okay. Remember, both are ENM related modifiers. These two modifiers you can use only with 99 series codes. Okay. Evaluation and management codes. Okay. You will get 99, 2, 3, 4 series. Okay. Only in this range you will get codes. ENM services. You need to add these two modifiers, 25 and 27. So when you will use 25 modifier means they will identify separate procedure on the ENM day. They're performing evaluation and management service and they identified one separate procedure like 1 to 6 pro series procedure they identified. They performed on the evaluation and management day. They performing evaluation management with separate identified procedure. On the ENM service, they done biopsy on the breast. Okay, along with ENM. So at that time, you need to use these 25 modifier with ENM codes. Okay, only with ENM codes. Okay, along with ENM, they done one surgery. In term of simple. Along with ENM, they done one surgery. We are adding 99 code and 126 code, series code. At that time, for 99 series code, you need to give 25 modifier. Clear?
Yes.
Patient performing ENM 99 series and you are coding 126 series code. Okay, CPT also you are adding. Along with ENM, CPT, both you are adding. At that time, along with ENM, you need to give 25. Then 27, okay. Same day, they done two ENM services. Multiple outpatient hospital ENM encounters on the same day. Same day, they done two ENM encounters, okay. Two ENM, 99 series, two ENM, two emergency encounters they performed. You need to give 27 for the second visit, second time CPT. Clear? Guys, do you understood or not? Tell me at least.
Understood, sir.
Yes, yes.
Everything clear, right?
Clear.
Yes, sir.
25, 27, 73, 74, 76, 77, 78, 79, 91. So if you remember or not, no issue. But F series, X series clear, right? F
Yes,
series,
yes.
T series, X series. In this three, you will
Yes.
get 2 questions. Okay, in exam point of view. Remaining
Yes,
all,
yes.
you don't get any questions. So if you remember your wish, if you don't remember also no problem for exam. So next modifier, reduced service. So what is the meaning of reduced service? Reduced
If the
service.
procedure is partially done or
Mm.
unsuccessful like that.
Yeah, so unsuccessful, okay. They done procedure, but that procedure was unsuccessful. Patient have foreign body and the soft tissue, but they unable to remove that foreign body. They done all the things. They done incision, there is the blade, but unsuccessful to remove the foreign body. Okay, then if you add only CPT, they will get complete payment. If you are not, because that unsuccessful, if you are not adding any CPT, they done some workup, they tried. So for that, they need to get some benefit, no? Some payment at least. So for that, you need to give 52. Suppose they done 70% of the procedure, then the procedure was unsuccessful. They stopped. They canceled 52, reduced service, which means the complete definition of the CPT description will not finish. Okay. The CPT description will not finish completely. Then you need to use reduced service. Suppose patient have one bilateral service procedure, which means the description mentioned that procedure was bilateral. Okay. The bilateral word included in the description. So what modifier you will add? They done procedure completely bilaterally. Suppose I'm saying example, tonsillectomy and adenoidectomy procedures are bilateral procedures. Okay. If they remove tonsils both sides, that procedure description fulfill. So if they mention in the record like patient performed bilateral tonsillectomy. So what modifier you will add here along with CPT?
50 modifier.
50.
Why you need to give 50?
52.
The description included bilateral, right?
52.
Why you
Tonsillectomy
need to give
itself
52? Why you need to give 52? They done description completely right. Mentioned bilaterally and they performed bilaterally. In the description saying the CPT description, suppose code was 42562 tonsillectomy. That code was bilateral procedure. If they done tonsils bilateral, you need to give that code. They done bilaterally. Then why you need to add 50 modifier? The description itself, it says no, it was a bilateral procedure.
Yes, sir.
So when you need to not use 50 means, remember the description, CPT description states it was a bilateral procedure. Then no need to add 50, guys. Okay. Already the bilateral word included in the CPT description. Then again, why you need to add 50? Clear? Any confusion?
So if it's given 50 in the question itself, so you're not supposed to use 50 modifier. You need to use 52 as reduced.
What you are saying? Tell me again.
If in the question itself is saying bilateral, you're not supposed to use 50 modifiers, right?
Yes. Okay. If they said bilateral, no modifier required. Not 50, not 52. No modifier required.
Yes, sir.
Okay. Suppose the description states bilateral, but they done the same procedure unilaterally. Then you will use RTLT or you will reduce the service.
RTLT.
Reduce the service.
Why you will give RTLT? You need to reduce the service now.
Yes, sir.
You need to reduce the service. Okay. The CPT description states bilateral, but they performed unilaterally. Suppose the tonsillectomy procedure was bilateral, but they done unilateral tonsillectomy. If you add CPT, they will get complete payment for both complete description of the CPT. So at that time, what you need to do? 52 modifier you need to add for unilateral. Reduced service, they done one side. For bilateral service procedure, they done unilaterally, you added reduce the service 52. Clear?
Okay, sir.
So please remember, same question you will get in the exam, guys. Patient performed on 11-year-old by unilateral tonsillectomy. What modifier you will add? 50, 52, 59. 52. Clear?
Yes.
So
Okay.
any doubt? 52, F series, T series, X series.
No.
So these three clear means exam related modifiers clear. Okay. Apart from that, remember remaining modifiers. Okay. So then come to some modifiers we can discuss. 47. Anesthesia by surgeon. What is the meaning? Anesthesia by surgeon means
The surgeon give the anesthesia.
Anesthesiologist is not
patient.
involved in this process.
yeah. So generally anesthesia who will give? Anesthesiologist, right? For
Yes.
anesthesia, general anesthesia will give by anesthesiologist. Okay. Sometimes absence of general anesthesiologist, surgeon only given anesthesia and surgery performed. Both only performed by same physician. At that time, you need to add along with CPT procedure code with 47, which means the surgeon also same physician. Okay. Then come to 62. Two surgeons. Two surgeons means the procedure performed by two surgeons. Two surgeons done same procedure. Okay. Two surgeons performed same procedure. Like 66 surgical team, which means more than two members. Like transplantation, major procedures will not performed by one or two physicians. No? Group of physicians will work on the procedure. Like if they wanna do heart transplantation, group of the procedures will work. So surgical team wise they will do. So surgical team 66 you need to add. Procedure performed on less than 4 patients 63. Okay. 62, 63, 66 clear, right?
Yeah, yes, please.
Okay. So that's it guys, modifiers. So remember, for exam purpose, 52, F series, T series, X series modifiers, XE, XS, XP, XE. So who are not taken the snippet, please take the snippet for this. I think I already shared this material with you. If I didn't share, you can take the snippet for this. Okay. Modifiers clear?
Clear, sir.
Yes,
Yes.
Yes, sir.
Thank you.
Sir,
Sir,
Yeah.
sir, first you have
Tell
Hello?
me.
first you have shared the మీకు ముందు ఒకటి CCS ది MCQs ఆ పేపర్ అని పంపించారు కదా అది ఫస్ట్ అందులో కొన్ని ఆన్సర్స్ మళ్ళీ అప్డేటెడ్ దానికి ఆన్సర్స్ కొన్ని డిఫరెంట్ ఉన్నాయి సార్.
సో లాస్ట్ ఏది షేర్ చేసానో అదే ఫాలో అవ్వండి. ఓకేనా?
అవునా? అంటే అలా
అవి ఇప్పుడు
కొన్ని
నేను డిస్కస్ చేస్తాను, డోంట్ వరీ. దట్ ఐ విల్ డిస్కస్ ఆఫ్టర్ ద క్లాస్. ఓకే?
అలా కొన్ని ఆన్సర్స్
I will discuss 1 minute, bro. So up to CPT, no doubt, right? I will give time. Clear? So modifiers, symbols, no doubt, right?
Yes.
Paper wise, I will discuss, don't worry. You can give me some time. I will take extra session, don't worry. Okay. Symbols, modifiers, clear, right?
sir.
yes, sir.
Yes, sir.
Thank you. So next, we can discuss how to use CPT book and leading of the CPT. Two parts we covered, symbols, modifiers. Next, how to use CPT book. What you will get the code structure, how to find codes and all we can discuss. Okay. This is the CPT book, guys. So for any book, first you need to check table of contents. Okay. Table of contents important, which means on what page what you will get. Okay. Contents important. Which page, what they mentioned. That's important na for us. Okay. How the book page numbers you will get, on that page number what you will find, everything we can discuss now. So the CPT book start with first evaluation and management service course. Okay, evaluation and management service course, the book will start. Then anesthesia course. So remember, evaluation and management course start with double line series, anesthesia course start with 0. Okay, the book start with double line series, evaluation and management, then anesthesia 0 series, then surgery guidelines, guys. Surgery 1 to 6 series course you will get in this surgery. All the CCS exam related questions you will get from this series on surgery section. So here, based on the type of surgeries, like based on the system, you will get number, first letter. So integumentary system course start with 1 series. Okay, 1 series. Like skin and breast related procedure start with 1 series. Then musculoskeletal system start with 2 series, muscle and joints. Then respiratory to mediastinum, respiratory, cardiohemic, mediastinum procedure start with 3 series. Digestive start with 4 series. Digestive start with 4 series. Okay. Then urinary, maternary care 5 series. urinary, male genital, reproductive, intersex, female genital, veterinary care. Then endocrine, nervous system, eye, auditory, operating microscope, 6 series, 5 series, 3 series. Okay, clear? 1 to 6 series surgery codes. Then radiology, like X-ray, CT, MRI, all you will get 7 series. Pathology, labs, you will get 8 series. Then medicine procedures, 9 series. Okay, this is the CPT code. In this sequence only you will get codes. Okay, the code series start with 99 series ENM. After 0 to 9 series codes, you will get sequencing manner. This is the CPT book arrangement. So you won't get any question evaluation management and anesthesia. So 1 to 6 series you will get the questions. Surgery, we can discuss this series codes only. Okay.
Okay.
Clear? So now you understood, right? And if the code start with 2 means which related procedure that was?
Musculoskeletal.
Musculoskeletal. 4 means
Digestive.
digestive. Okay, like that. Remember. Apart from this, next. Okay. Yeah. After this, so remember, guys, in ICD and PCS, you will get index starting, right? CPT code index. Sorry, ICD and PCS code index you will get starting now.
Yes, sir.
Code leading index, guys.
Yes, sir. Yes, sir.
But in CPT you will get at the end. Okay, index. End of the CPT you will get index. This is the CPT index. From here it will be start. Okay. So how to use CPT index? They given some guidelines here. Main terms, conventions. So how, if they mention like this, means how to select. Okay. Like this, the modifying terms, removal, foreign body, how to lead the code, they given, and it will start with A to Z. Like any book, ICD, PCS, same. It will start with A to Z. Okay. Sometimes you will get one code. Sometimes see, they will give 3 to 4 codes, which means in these 3, one was the correct based on the guideline, how they are used. Okay, like this. They are given 2 to 3 codes for sometimes. Sometimes they will give sequence range 95144, 95165, which means in this range, the code you will get. And that range code all related to this procedure. Based on the specificity, the code will be changed. Okay, like that. You will get sometimes directly one code only you will get. That time you can select directly in the index. Okay. Like this, you need to use index. Suppose they've removed foreign body in the eye. So what is the main term here?
Removal.
Removal.
No, I'm showing one example. Removal. Removal. So foreign body, cornea. They done slit lamp. With the slit lamp, they removed foreign body in the cornea. What is the procedure? 65322. If they perform without slit lamp, 220. Okay, like that. Okay, clear, right? How to use the CPT index. Now you get understood, no?
Yeah.
At the end of CPT book, you will get this. And then you will get the procedures like this. Integumentary only. Remember, I am explaining only surgery. Okay, no anesthesia, no ENM. You don't get single question. And don't expect like a CPT, CPC range. Okay, it will be what important for CCS, that's it. Okay, if you wanna explain like CPC range, it will take 1 month time for CPT. Okay, we are discussing only exam purpose of the CPT book. Okay. So this surgery onwards, we can explain how to use the book. So before going to the lead of the course, everything remember, guys, you will get the description of the CPT code. Okay, you don't get directly the code like CPT, ICD and PCS. You need to read the description and you need to match with the procedure. Suppose they mention fine needle aspiration body with imaging guidance or without imaging guidance, with including ultrasound guidance. Based on that, suppose they mention fine needle aspiration biopsy without imaging guidance, first lesion. What is the code? 10021. Suppose same they done fine needle aspiration biopsy, including ultrasound guidance, first lesion. Then
100.
1005. 13005. Correct? 13005.
Yes, sir.
Yes.
So which means if they're done without imaging guidance, 10021. With including ultrasound, they perform same procedure, 13005. So you need to read the procedure complete description and you need to match with the procedure code in CPT. Before going to that, you need to remember, guys, how you will get some different codes for same procedure. Okay, you need to check two things at least in the CPT code lady. First thing, they performed procedure open or scopy. Okay, they performed the procedure or open or scopy. CPT procedure. They performed open or scopy. You need to check. For same procedure, if they performed under scopy, you will get different code. If they done open, you will get different code. Clear? I will show some example, then you will understand. Majorly will get in 4 series, digestive related only, laparoscopy, colonoscopy, EGD. All scopies you will get in this procedure. 4 series, okay? They will use colonoscopy, EGD, all. No? So what is the description of 47562?
Laparoscopy, surgical.
Surgical
Cholecystectomy. Cholecystectomy. So what is the 47600? Cholecystectomy. Both are cholecystectomy procedures only, no?
Yes.
What is
One
the
is
difference?
laparoscopy and one is open procedure.
Okay, one was open, one was scopy. This is open cholecystectomy. This is laparoscopy. If they performed under scopy, 47562. If they done open, 47600. With cholangiography open, 47605. Cholecystectomy with cholangiography under scopy, 47563. Clear?
Yes, sir.
Yes. Yes, sir.
So what is the code? 47610.
Exploration of common duct cholecystectomy. This exploration.
Cholecystectomy with exploration of common bile duct, 47610. What is this code?
47464 for laparoscopy.
Cholecystectomy with exploration of common duct under scopy. Correct?
Laparoscopy.
Under laparoscopy, if they performed same procedure, 47564. Clear?
Yes.
Mention same now. Cholecystectomy with exploration of common duct, and down also is like
See, both are cholecystectomy only with common
yeah.
exploration of bile duct. So these are the heading laparoscopy, which means all these procedures are performed under scopy. Okay.
Okay.
This is excision, means open. These all are open procedures. Okay. Heading
Yes,
change.
sir.
These are open procedures for same procedure. These are laparoscopic codes for the same procedure.
Yes.
Okay. So first thing, if they done procedure means you need to check they performed scopy or not. Then one more thing you need to check, guys, if they done any procedure under imaging guidance by using fluoroscopy, by using ultrasound, like that. Then check that imaging guidance included in the procedure or not. With imaging guidance code, you will find separately or not. That imaging guidance included or not, that also important. Clear? So open and closed also you need to check. And you need to check imaging guidance included or not. You need to code separate or the imaging guidance included or not. So what is the meaning of 62320 321? Tell me.
It is an diagnostic therapeutic substance. It is an imaging.
With
Like-
imaging guidance, without imaging guidance.
Yeah. So they done injection diagnostic therapeutic substance on cervical and thoracic region without imaging guidance. 62320. If they perform same procedure under fluoroscopy or CT, what you need to code?
62321.
321. So while you are coding 62321, you will code again fluoroscopy or CT code separately, 7 series radiology code.
No.
No.
Clear that imaging guidance included in this CPT. See, do not report 62321 in conjunction with 77003, 7702, 7694. These are CT and fluoroscopy codes that we should never code separately again, because 62321 included imaging. Okay?
Okay.
So,
Okay.
clear? These things remember, guys. So here also check what is the 13005 code description. First needle aspiration biopsy including ultrasound guidance. So here you will give ultrasound guidance again.
No.
No.
See, do not report 13005, 13006 in conjunction with 76942. Ultrasound code they are asking, no need to require. Okay, if they're done under imaging, that like including CT, including fluoroscopy, under fluoroscopy, like this words included in the procedure description, don't use 7 series codes. Under, if they mentioned open or scopy, check. If they mention scopy, code scopy related procedure. If they're done open, you can code open. If they performed open cholecystectomy, if you coded laparoscopic cholecystectomy code, it was correct.
No.
No, right? So if they performed open means you need to code only open related procedure. If you selected scopy related, it will be wrong, no?
Yes.
So clear, right? So scopy, trocar, scope, they will give this type of words for scopies. Okay. If you find scopy, trocar, like this means you can check it was a scopy procedure.
Okay.
Any doubt? How to use the CPT book? Scopy open with image, including image means you need to give additionally 7 series or not, and modifiers.
No.
Thank you,
If they
guys.
did not mention open, if they did not mention
Suppose that
scopy,
imaging guidance
we
not included in
capture
the, suppose, wait. The imaging guidance not included in the procedure description, but they performed under imaging guidance. That time you need to add 7 series separately. Okay, what? The imaging guidance was not included, but they performed under imaging guidance. At that time, you need to use 7 series separately.
yes.
Okay.
If they did not mention the imaging guidance, we can default open. We
If
can
the
capture
patient
data.
imaging guidance default open, what open? If they performed SCOPy or open means, they not mentioned SCOPy, then open default.
Okay.
That was separate guideline. And imaging guidance included or not separate guideline.
Okay.
Okay. Open SCOPy means separate procedures you will get. If they mentioned including image on the description, no need to code radiology code again. If they didn't
Okay.
mention that imaging guidance not included on the CPT description, but they performed on the CT or fluoroscopic under, then you need to code that 7 series again.
Okay. Okay. Thank you.
Clear? Huh?
Yes, clear.
Thank you. Everyone clear, right? I think.
Yes, sir.
So no problem. Tomorrow onwards, we can go through CPT related questions. So in this, you will get 3 multiple choice questions and 4 case studies from CPT. Apart from modifiers, okay? Modifier 3, CPT coding 3 questions and 4 case studies. We can discuss at least 10 CPT codes if you remember means enough for example. We can discuss that 10 CPT codes related tomorrow. Clear? After that, based on your interest, if you are interested on ICD, we can continue ICD. Otherwise, I will explain paper for you. Okay?
Okay, sir.
ICD also, sir.
Yeah.
Okay.
Okay. Based on your interested ICD, I will explain. Okay?
Sir, we want ICD also, sir.
Yeah, that only I'm saying. I will explain anyway. I'm saying who are not interested, if they ping, I will explain paper. Who are interested in the everyone ICD means. Clear? Huh?
Yes, sir.
Okay, guys, then thank you. So